I'm going to give a report on my patient who came in for a head-to-toe assessment. Patient stated his age was 14. Patient was alert-oriented times 3. BMI was appropriate for the height and the weight. Also, the patient's good nutritional status. He has access to 3 meals a day. Patient posture was good, was sitting straight up. Patient was in a good mood, happy, states he's always happy, in a good mood. The natural language is English for the patient. No personal hygiene problems were noted. Patient appeared to be nice and clean. Also, the patient gait was steady upon walking in. No assistive devices were noted. No abnormalities, no deformities. Also moved on to the skin, the upper extremities. The hair distribution was noted. The color was appropriate for the patient's race. The skin was warm and dry. The peripheral pulses were palpated, the brachial and the radial. Also, the hands and the nail beds were clean, and the capillary refill was less than 2 seconds. Moved on to the scalp. The patient denied any tenderness upon palpation. No lumps, bumps, or bruises were noted. The hair color was black. No dandruff was noted. No lesions to the scalp. Moved on to the face. The face was symmetrical. Cranial nerves 1 to 12 were assessed. The frontal and the maxillary sinuses, patient denied tenderness upon palpation. Also, the temporal artery was palpated. Moved on to the eyes, the external structures of the eyes. No drainage or irritation was noted. The sclera is white. The conjunctiva is pink. The cornea was assessed from the side. No concave noted. Pupils were equal reactive to light and accommodation. Also, the iris is black. The external structures for the ears, no drainage was noted. Denied tenderness upon palpation. Also, the eyelids, the eyebrows, eyelashes were assessed, were all intact. The nose, the septum was midline, the mucosa is pink. No drainage noted from the nose. Also, the nose was, the septum was midline and bilaterally patent. The lip was, there was no lesions, no cracks, no irritations noted to the lip area. Also, the mucosa for the hard palate, the soft palate, the tonsils, the gums, the tongue were all assessed, were moist without exudate. Also, we moved on to the neck, negative for pulsations. The neck was inspected. No thrills were noted upon auscultation. No thrills, murmurs, or bruits were noted to the carotid artery. Also, they were all palpable one at a time. No thrills, bruits were noted. The trachea is midline. No enlargement was noted to the trachea upon palpation. Also listen to the breath sounds anterior and posterior. Posterior AP to T diameter. The scapula and the spine were midline. Also the CVA was for tenderness was negative to the posterior chest. Anterior, no accessory muscles were used. Breath sounds were clear anterior and posterior in all lobes. Also, we moved on to inspect the abdomen at eye level. The umbilicus was midline, no striae, no scars. The abdomen was flat, no concave noted. Also, bowel sounds were active times 4 quads. Patient denied any tenderness to deep and light pulse palpations. The patient denied any light or deep palpations to tenderness. Also, we moved on to the extremities, the lower extremities. No edema was noted. Hair distribution was noted. The color was appropriate for race and age. Checked the femoral pulses. They were palpable. The popliteal pulse, the dorsalis pedis, the posterior tibia pulses were all palpable. Also, we moved on when we checked the chest. The heart rate was regular in rhythm. S1, S2 was noted. Also, the apical pulse was palpated at the fifth intercostal space, the left side mitral valve. S1, S2 was noted. Also, respirations were even and unlabored at 18. Also, we checked the leg to shin was negative to the lower extremity. Scoliosis was negative. Also, the patellar reflex was 1+. And that concludes our report on our patient.